Good afternoon, I'm Josh Fenton. We have a coronavirus update. We're Skyping in with Dr. Michael Fine, former Rhode Island Department of Health Director. Doctor, welcome, and thanks for tuning in again today.
Hi, Josh, it's nice to be here.
Great, lots of things are going on. Let's start with the numbers at the highest level. We've got now about 120,000 globally, about 4,300 deaths across the globe, but also some huge spikes and some hot spots around the country. We see one meeting in Boston, Massachusetts, now linked to 70 different cases.
And we're going to see more. We're likely going to see more cases. Remember, the American cases are limited by our limited testing. We have not been testing that many people. And so it wouldn't shock me if as we start testing more, we see more cases. But one of the really interesting set of numbers is the set of numbers coming out of China, if you can believe those Chinese numbers. And that is in Wuhan, where this started. They're down to 17 to 20 new cases a day from 2,000 a day. That's a really remarkable change. And that gives us a possible pathway to getting this somewhat under control.
Well, let's talk about that. In Newport, the governor just came out announcing that she is asking the city to postpone or cancel the St. Patrick's Day parade. It is an event that brings tens of thousands of people to to Newport. It kicks off their sort of spring and summer tourism season. And last night, the city voted against revoking that permit. What's your directive? What's your thoughts on these community events?
Well, I think most community events, which are really important to everyone's sense of community and also sometimes to the economy, all these can be moved back a couple of months. There's no risk, no substantial risk to the lives of Rhode Islanders if we push things back till July or August. And yet there is a significant theoretical risk to having events like the one in Newport or other large events. There's just no reason not to postpone anything we can postpone, from regular meetings becoming phone meetings to governor's task forces happening online, to religious services being pushed back or limited as much as possible. This is the moment to really quiet things down in the hope that we can prevent the intensity of the rise of new cases so that we get a manageable outbreak, not one that really strains our capacity to cope with it.
The smartest schools at the university level, those that are ranked highest, seems to be moving very aggressively ahead of the game to move to online learning. Stanford, Harvard, Brown's poised to, Princeton has, etc. Those lessons, they've got the best scientists in the country, they've got the best med schools in the country, they're tapping that expertise. Do we need to really reinvent the wheel to take that learning and pass it along to K through 12 learning?
Well, I think we need to look at it quite seriously. They have some advantages that our K through 12 schools don't have. All of their kids have a computer they can go online and do online learning on. And, I hate to look at the fiscal side of it, but, for all those places, the tuition for the spring has already been paid. Nobody's going to lose anything to quiet things down. In our environment, in the K through 12 environment, it's a really complicated problem, particularly for places that are more economically stressed, where parents really rely on kids being in school for childcare in many ways, so they can work, because often, those families are living paycheck to paycheck. And the education of those kids is even more critical. The kids at Harvard and Stanford, they already know where they're going and they've gotten a fair bit. But our kids in Pawtucket and Central Falls and Cranston and Providence and Warwick and elsewhere, all across the state, our kids are our future, and we want to make sure they get the best education they can to realize that future. So it's not so simple. But the one thing we know is the data that strongly suggests when there is an outbreak, when there's clear evidence of an outbreak, the sooner you close schools, the fewer and less intense cases that you have. And that favors closing schools sooner rather than later. Our problem, as I see it, is that we haven't been testing enough people to have the science to make decisions on. So, if we were testing every single contact before their 14 days were over and we saw no evidence of spread, that would make me think that we can, wait a little bit. But if we were testing every contact and saw spread, and the moment we see community spread, I think that's an argument for shutting things down.
We know two learnings, at least so far, since the outbreak that began in December in Wuhan, China. We know that children are not highly susceptible to damage from this virus. It seems to pass through them with minimal risk, not non-existent. And the second thing we know is that older citizens, 70s, 80s, 90s, and those with pre-existing health issues are very susceptible to this, and the death rate is significantly higher. Italian numbers are maybe even as high as 6%. We know that students are little germ machines, and kids who live in urban communities have much more contact with their grandparents in many cases. So in order to protect the older population, do we need to be moving quickly?
Well, I think that's the argument in favor, in fact, of moving quickly. Remember, this is like flu, but not flu. So as we learn about it more, we'll know more. For the moment, we use flu as our best analogy. But for influenza, 6-year-olds are the kids who transmit the disease, and they transmit it to their grandparents. And so, in fact, the sooner we can close schools or restrict transmission among that younger group, the better we're going to protect the elders. Now, I want to take a second and challenge the assumption that kids are not at risk. We don't believe kids are at risk now. But even for influenza, influenza kills 100 to 200 kids a year in the United States, but that's in the context of having between 9 and 45 million infections. Mm-hmm. We've only seen 120 infections from coronavirus worldwide, so we don't really know the impact on children and won't know it till we see the same kind of numbers that we see for influenza in terms of number of infections.
If you had one recommendation to the governor, what would it be today?
I think to continue doing what the Department of Health is doing, I'd like to see us testing many more people to give us real science, real numbers about what our risks actually are. And I think continuing to argue that we put anything that's optional online or cancel any meeting, this is the time to quiet things down. One thing it's important for people to remember, and it's important for us to start talking about this. The thing that's important to remember is it's reasonably likely that many, if not most of us, will get coronavirus in the next couple of months. Thankfully, relatively few of us will die of it. Our objective ought to be to reduce the number of people who get it at once, to spread out this process, so instead of it all happening in 3 or 4 weeks, that it happens over 2 or 3 months. And that gives our hospitals and intensive care units and our healthcare professionals the time to get to each person who really needs our attention. So I don't think people need to be afraid of this disease. I don't think they need to be shocked if they get it. I think it's going to be here, and most of us are going to get it, and I think we'll do fine at the other end.
Last question. Will our healthcare system, our staffing of the healthcare system, begin to tire and wear down over the course of this? Because the existing healthcare issues are still prevalent. It's still flu season. We still have people who need their appendixes out, etc. Will the overall system, the 2,200 to 2,300 beds in Rhode Island, begin to stress?
No way to know. I mean, I think people are making smart decisions about putting off things that are optional. We have a great cadre of healthcare workers who are totally dedicated to their work, and it's important that we recognize that and support them. Um, we have some technical risk because we don't have as many primary care people as we need. This is an obsession of mine, as I think everybody knows, but in China, about 60% of people who are in China have a primary care doctor. In the United States, the average is less than 43%. Rhode Island, we do a little better than that, but that gives us less capacity to take care of everyone who's sick as they're sick. The emergency rooms of the hospitals just can't do this. This is something for us all to do together. And so a lesson for us for the next one, because there will be a next one, is to keep building the strength of our primary care delivery system so every single Rhode Islander has a primary care doctor, clinic, or practice, so that everybody has access to the care they need the same day they need it.
Dr. Fine, thank you so much for tuning in, for joining us today. Appreciate everybody for watching. There's going to be a lot more on what's developing on the coronavirus across Rhode Island, the region, and the country and the world. GoLocal's trying to stay on top of every twist and turn as this thing develops. Thank you very much, Dr. Fine. Stay tuned. This afternoon at 4 o'clock, Governor Raimondo is holding a press conference to update the media and the public. Kate Nagel will be there at 4 p.m. Thanks, everyone.
Thanks, Josh.